Hi, let's talk about some respiratory diseases or conditions. And let's start with carbon monoxide poisoning. Okay. Um, all right. So carbon monoxide, you can't smell it, you can't do anything. So make sure you have a carbon monoxide monitor in your apartment or your house. Here's the problem with carbon monoxide. It's going to bind to the iron in the middle of the heme of hemoglobin at the exact same site where the oxygen molecule would bind. And you'd go, well, okay, I'll just hook myself up to an oxygen tank. Well, it's not that easy because carbon monoxide binds 20 times harder. So you can't just hook yourself up to oxygen tank. It's not going to work that way. The oxygen is not going to displace the carbon monoxide from its tight binding. Okay, so you need to go into a hyperbaric chamber to move the carbon monoxide off of it. So the problem with carbon monoxide poisoning is at first you're going to have a headache or some nausea, but people with carbon monoxide poisoning, they die in bed and they tend to have this cherry red coloring if their carbon monoxide levels are higher than 30%. Which is usually what happens when you die from carbon monoxide poisoning from a faulty heater, space heater. So every fall, before you turn on your heating system, call your local gas company or your fire department. They will come out and check it for you free of charge. All right. An upper respiratory infection is known as a URI. It's a viral infection up here in your head and neck area in your upper respiratory tract. It can spread from your nasal cavities into your sinuses, to your middle ear, to your larynx because it's a viral infection. No antibiotics. If it lasts more than 2 weeks, and the discharge, which was whitish or yellow, starts turning green, or you start getting a fever after 2 weeks, maybe you'll have a bacterial superinfection after the fact. But otherwise, it's viral and it's just symptoms. And by the way, you want to know the common name for URI? It's the common cold. There's no point going to see a doctor for it. They're just going to charge you your copay. You can go to a pharmacy and just get over-the-counter stuff to help you feel better. Do not buy stuff that's going to turn your secretions into concrete because it's just going to make you sick longer. And that's especially true for sinusitis. Because what's happened with sinusitis is nasal congestion has blocked the opening to your sinuses. And so now that congestion is in your sinuses and you have facial pain, which is especially worse if you're leaning forward, if you're sleeping flat on your sides or on your stomach. So to help drain your sinuses, stay upright, sleep upright, take hot showers. Do not take antihistamines because they thicken your secretions. Go to the pharmacist, ask them, how can you thin out your secretions? Yes, you're going to have a runny nose. Put Aquaphor or Vaseline on the tip of your nose so you don't end up with the raw redness on your nose. You need decongestants. All right. Middle ear infections called otitis media usually follow nasal infections because it goes up your eustachian tube. The other most common reason is in little children under a year or around a year age, when parents have them lie on their back and have them hold their bottles because they're lying on their back. That liquid is going straight up their eustachian tubes into their middle ear. So please hold your children upright when you're feeding them with a bottle rather than having them hold their own bottles. Antibiotic overuse can cause bacterial resistance with otitis media. So definitely see your healthcare provider and seriously consider using ear tubes for this. Here is what a bulging tympanic membrane looks like. Consider going to your healthcare provider to get this punctured, because if you let it rupture on its own, you're not going to have a nice little puncture and you're going to end up with bigger scars, and it could end to significant hearing loss when you are older. And here's what the little tympanic membrane tubes for drainage can prevent the hearing loss, and they can stay in there for drainage for a year or more and prevent recurrent middle ear infections with scarring. A lot of us have had laryngitis, basically itis, inflammation of the larynx. We recognize it as hoarseness. Sometimes we get it after an athletic event because we're going rah, rah, rah too much. Other times where we get laryngitis is because we have an upper respiratory infections. And as that upper respiratory infection gets treated or goes away, the laryngitis will go away. If you have persistent hoarseness, that is a warning sign for throat cancer. So if you have laryngitis for 6 months, go to a healthcare provider, especially if you're a smoker or if you use tobacco, snuff, or anything like that. So here's what a normal vocal cords look like. They're usually this whitish color, very pretty, and you can see the trachea down there. The rings of the trachea below it, very nice. With laryngitis, you can see that they look more swollen now as opposed to they did there. See how sharp and crisp the edges here, whereas here it is swollen, and you can see more blood vessels on this. And you know how you're told don't talk when you have laryngitis, and so many of us decide, okay, I'm not going to talk, I'm going to whisper instead. That's like one of the worst things you can do, because you're still irritating it. And if you don't follow directions, your laryngitis is going to get worse. And it can look like this and become hemorrhagic, and that's not a good thing. Okay, so please listen to your healthcare provider, follow their directions. Okay, bronchitis, inflammation of the bronchi or bronchioles, okay? And so what's going to happen is it's going to get swollen, the whole inflammatory process. We're going to have mucus because, you know, we have that typical respiratory epithelium with the goblet cells secreting all the mucus. So not only is the lining thicker from the inflammation, now we have the mucus in there. So we have a very narrowed airway. And this usually follows a viral upper respiratory infection. And you have this cough. At first, it's very non-productive. So you have this very deep hacking cough. Sounds almost like a barking cough. And then as the inflammation becomes worse and you start getting more liquid and more mucus, you can start coughing up mucousy stuff. Take showers so the mucus doesn't get stuck like there. Do not take those antihistamines. Do not take anything that will dry this out and give you mucus plugs. You want to be able to cough this stuff up. If that means taking a couple of showers a day to cough it up, fantastic. If you don't, what's going to happen is you're going to end up with a secondary bacterial infection, and then you're going to end up with pneumonia, which is not a good thing. All right. Asthma, very common. It's a disease that affects your bronchi and especially your bronchioles, and they become hypersensitive to irritants, especially any kind of pollutant, any ash from local fires, any stuff floating in the air, allergens, hay fever, avocado orange bloom, really dry air from Santa Ana's. It's treatable, not curable. There's two components with the asthma attack. There's the inflammatory component. This requires a chronic treatment. It is not a go to the emergency room and get a steroid, which is going to cure it. Yes, you need to have a chronic treatment for the inflammatory component to prevent the inflammation. There is no emergency treatment that will get rid of inflammation overnight. Okay. The airway constriction is due to the smooth muscles contracting. Remember, we showed as we lose the cartilage, we gain the smooth muscle. So that is your rescue inhaler, which can cause that smooth muscle to relax. So that is the only part that can be treated in the emergency room. So there's two parts that need to be treated. So don't just be relying on a rescue inhaler. If you know somebody with asthma and they've had to use the rescue inhaler 3 times in 1 year, it's because they are not treating their asthma seriously and they need to be on a chronic preventive treatment. If we look in the worldwide where there is asthma, you notice the United States is and Australia and are really high spots for asthma, and it's definitely associated with low socioeconomic parts with asthma. Cockroach dander is super allergenic, and the other thing is as obesity rates go up, asthma rates skyrocket. And the other thing is the good news is for asthma is if you can get health care, you won't die from it. But if we look for places where there is not adequate health care, that is where the rates of death from asthma are high. And yes, the United States is the yellow color for death rates, and that has to do with the poorer people who are only going for emergency room treatment rather than preventative treatment. All right. So pneumonia is when you have either a viral or a bacterial infection that's affecting the alveoli, and it's often preceded by influenza, which is a viral infection. Okay, and so what is happening here is you're going to end up with fevers, headache, chest pain, and the net result is because you have this inflammatory problem happening in your alveoli, you're going to have decreased oxygenation. So instead of having these beautiful alveoli that you see down here, you're going to have alveoli which are chock full of inflammatory cells, lots of neutrophils, lots of macrophages, and then you're going to get pus and fluid and all kinds of stuff. And so air can't get in there. You can see it on x-ray because you're not going to have the blackness that you see when air goes in. You're going to have the whiteness because air can't get in there. And it's usually localized to either a segment of the lung or at least just one lobe of the lung. Tuberculosis is an infection of the lung from an organism that basically, when somebody coughs on you and they have TB, when you are inhaling from just breathing, then you are inhaling the organism. And you can do that when they don't even know they have tuberculosis. And tuberculosis is really hard to diagnose. People who have tuberculosis may or may not have fevers and chills. One thing that's pretty common is having night sweats. If you're the age where you would be a menopausal, perimenopausal woman, you would attribute your night sweats to that. One common thing is that you would have a cough that would last for more than a couple of weeks. You can lose your appetite and lose weight. If it's very easy for you to lose weight, could be due to tuberculosis. And if there's ever a time that you're coughing up blood, you definitely need to see a healthcare provider. And the reason why people with tuberculosis cough up blood is one thing that happens with tuberculosis is that it can create cavities in your lungs, and you just have millions of these organisms. And anytime you're coughing and you're sneezing, you are just spreading this in the room, the classroom, where you're eating, where you're walking, buying your groceries, anywhere, you are just spreading it to everybody. So one student in a classroom is known to be able to spread it to easily 8 students before they are diagnosed. So if we look across the world, we will see that there's lots of tuberculosis in Africa, in Asia, and in South America. And you go, whew, thank God I live in the United States. Well, let's look in the United States. Any state that has immigrants has a significant rate of tuberculosis. So look at your state. Yeah. So that's why here in the United States, we do TB skin tests at certain grade levels. And then once you're an adult, depending on your job, you have to get TB skin tests. So if you're teachers or if you're in the healthcare profession, you get TB skin tests either every year or every 3 years. The big problem with TB now is there is a lot of drug resistance. And if you look here at the 2021, you can see where the drug resistance is. And worldwide, we know we have about 25, 30,000 people who are drug resistant. And of those, we know that about 1 in 3 of those who are drug resistant are actually getting treatment, which means 20,000 of them are not getting treatment. And what this means is that by 2050, tuberculosis it can kill 75 million people. Yeah. So in the 1950s, TB was a big deal. And then the numbers went way down. And we thought we had fixed the problem. And now what you can see is since the 1990s, it's made a huge comeback. So it's not a good thing. All right. A little bit about smoking. When you smoke a cigarette, it paralyzes your cilia. So they can't do their job. Now, if you continue smoking, if you smoke more than 1 cigarette, if you become a habitual smoker, then your cilia are gone. So your cilia and your respiratory tract are gone. And you're not only there, your cilia everywhere in your body are gone. Okay. So let's talk about your nicotine. It's going to enter your blood, which is going to make your arterioles go under a vasoconstrictor. So yeah, you're going to have cold hands, cold feet. Gentlemen, you're going to be impotent. You're going to have high blood pressure, so your heart's going to have to work harder. It's going to reduce your oxygen carrying capacity. All right, so let's look at the lungs. Here's a normal adult lung. But if you live in a city, you're going to have more tar just because you live in a city where there's more cars going around. But here's a smoker's lung with even more tar in it. Okay, I'll come back, talk more about smoking later on. Emphysema is a disease that in 75% of the people is caused by smoking. And what happens in emphysema, it destroys the wall of the alveoli. So instead of having all these lovely little grapes, the walls are broken. And remember, the walls were where gas exchange was happening. So you're going to have less gas exchange. If you have less gas exchange, that means you have less gas going to your body. So instead of having all these lovely little walls, you see here, you're missing all the walls here, missing all the walls here, and missing all the walls there. So here's a whole mount of a lung slice, what it would look like normal, and here's what it looks like with somebody with emphysema. So you can see that there is probably at least a half less gas exchange happening with emphysema. A lot less oxygen going to the body. All right, COPD, which stands for chronic obstructive pulmonary disease or chronic obstructive lung disease, has 2 components to it. All of the people with COPD have emphysema and they have chronic bronchitis. Yes. So they're going to have the inflammation and the mucus and the narrowed bronchi, as well as the destroyed alveoli. Oh, so they got 2 things. And yet they're smokers. So that's the risk factor. The other risk factor are chemical fumes. Okay, so if you worked in the petroleum industry your entire life, that's a risk factor there as well. And if you did both of those, oh my goodness, it's really bad. So people with COPD, they could actually have higher CO2 levels in their blood than they have oxygen levels in their blood. It's not a good thing. And because of this, and this disease, which you probably have never heard of, this is the fourth leading cause of death in the United States. This disease you've probably never heard of. That brings me to lung cancer. So I want you to realize lung cancer has become an equal opportunity disease for women. The Second World War, after that, it was a disease of men because men were the smokers, and then women, we wanted equal rights, we started smoking. And so now the risk of lung cancer is 1 in 17 women versus 1 in 15 men. Not a good thing. And if we look at mortality rates, you can look where in the United States most of the people with lung cancer are dying. We got a lot of deaths right in the part of the United States where tobacco is grown. I wonder why that is. I wonder. Okay, so let's look at lung cancer. The 5-year survival rate is 49% when cancer is only in the lung. Okay, so when cancer is found early, only in the lung, only 50% of people live 5 years. If it's in the lungs and in lymph nodes only in the chest, at 5 years, 16% will be alive. And if it's spread to other organs, 2% of people will be alive. In other words, if you have a diagnosis of lung cancer, you're not going to be, the minority of you are going to be alive in 5 years. So how many people are diagnosed when the cancer is confined to the lung? Only 15% of people. So out of these people up here, only 15% of them are going to be found early enough that half of them would be alive at 5 years. Most of them are found after it has spread to other organs. Okay. And death from lung cancer, look at all this cancer in the lung. Basically, you are suffocating yourself to death. It is not a nice death. All right. With that, I'm done with this section. I have one more section where I'm going to talk some more on smoking. So come on back and see what I have to say about smoking.